Hello friend, welcome to the channel Pharmacy Dictionary. In of our last class, we have studied about the enzyme inducer or enzyme induction. But now in this video, we are going to study about the enzyme inhibition, their respective introduction with few example and their basic use. Now what is the difference between these two terms, enzyme induction and enzyme inhibition? The word enzyme is common in both the term, but there is a difference in induction and inhibition which are opposite to each other. Induction means to start, to facilitate, to increase, but in case of inhibition, that is just opposite, to inhibit, to reduce. So what is reducing here? The enzyme, the amount of enzyme, the production of enzyme, the synthesis of enzyme will be affected here. In case of inducer, that will be increased, but in case of inhibition, that amount will be reduced. So today's topic is all about the inhibition process. So what are the enzyme inhibitors? If you are talking about the inhibitor, so it will include all those agents which may be drug, which may be environmental pollutant or any other substance. So whichever is inhibiting the synthesis of cytochrome P450 enzyme is termed as an enzyme inhibitor, and the process of this inhibitor is called enzyme inhibition. So this is very important. Two terms are related with each other. Do not need to confuse with the induction and inhibition. Both are just opposite to each other. So the example of enzyme inhibitor or the process of enzyme inhibition are example with cimetidine and ketoconazole. These two drugs are very important. Cimetidine is mostly example under the anti-secretory agent, and ketoconazole is one of the important constituent under the antifungal drug. You have seen in many ointments. So this ketoconazole and cimetidine is having property to inhibit the synthesis of metabolic enzyme. So what are they going to do? This cimetidine and ketoconazole bind to cytochrome P450 and completely inhibit the metabolism of endogenous substance like testosterone given concomitantly. So if you are giving the endogenous substance like testosterone or along with this testosterone, either cimetidine or ketoconazole, so this ketoconazole or cimetidine will competitively fight for the same binding site as in case of testosterone. So there will be a fighting for the same binding site. So the effect of this testosterone may not be optimum just because of the inhibition of the metabolism. And know very well that metabolism is important for many consequences, for conversion of inactive substance into active or any other substance. So metabolism, or I must say proper and optimum metabolism, is very essential and desirable process under the pharmacokinetic parameter. These are ADME. So AIM is also an important process. Coming to the next one, there's an enzyme inhibitors, a specific example. Apart from this cimetidine and ketoconazole, there are few mother drugs which are included under the enzyme inhibitor drug. These are chloramphenicol. These are very important, so you should remember this. At the last of this video, I am going to add a presentation, so you do not need to complete this video in this whiteboard section. Wait for the PowerPoint presentation also. Example are chloramphenicol, erythromycin, which is a very good example of antibiotic. Now cimetidine, as we have case in this anti-secretory drug. Next one is ketoconazole, antifungal drug, and ciprofloxacin, another example of antibiotic. So this antibiotic can inhibit the synthesis of microsomal enzyme like cytochrome P450 and the metabolism of the drug which has been taken simultaneously or concurrently with any of these drugs. So that drug metabolism may be inhibited. This is very important because these are the example of enzyme inhibitor which will inhibit the metabolism of that drug which is taken with this one. Coming to the next, that is an important note. So this is very important note. See, the binding of drug may be irreversible. So this is a binding process. We have discussed about the competitive inhibitor and non-competitive inhibitor. So the binding of the drug may be irreversible. That means that cannot be recovered again. That is called irreversible. So if the process is taking place, that means if the binding process of the drug is irreversible, that may inactivate the enzyme, and if the enzyme will inactivate, how any of the metabolism process can be take place? There is different. See, inhibition and inactivation, both are different terms. If you are talking about the inhibition, that means it will be reduced its proper amount. Suppose at a normal level, optimum level, this is the 100%, just for example. But in case of inhibition, it will be 90, 80, 70, whatever it is, but it will not be equal to 100%, but it will not be equal to 0 also. But in case of inactivation, there will be no such activity completely inactivation, not able to produce any of the effect. That is called inactivation. So there is a major difference between inactivation and inhibition. So if the process is taking place as the inactivation of enzyme, such substrate are called as a suicide inhibitor. This is very important terminology. You should remember it for your general knowledge point of view. Suppose everything is getting inactivated, nothing is there to perform its biological action, nothing is there to start metabolism, so nothing will be happen, no metabolism, no metabolite will be produced. So this is called suicide inhibitor, because now there is no chances. Inhibition can be increased by reducing that particular inhibitor drug, any of this, but how will you activate this inactivated enzyme? So the process will be terminated at the same point. That is why it is called suicidal inhibitor. Very important. And the example of this suicidal inhibitor are seleginine, ticlopidine and clopidogrel. These are important example. You should remember this name for in case of competition exam point of view, like GPAT, NIPER, pharmacist, railway inspector, drug inspector, etc., etc. So now coming to the non-macrosomal enzyme inhibitor. As we have studied, there are two types of enzyme present in the liver. These are macrosomal enzyme and non-macrosomal enzyme. We have studied about the macrosomal enzyme. Now it's time to study about the non-macrosomal enzyme inhibitors. So all those drugs which will inhibit the non-macrosomal enzyme called non-macrosomal enzyme inhibitor, like in case of xanthine oxidase, aldehyde dehydrogenase, alcohol dehydrogenase. So these are non-macrosomal enzyme which will inhibit the non-macrosomal enzyme are termed as a non-macrosomal enzyme inhibitor. These are also having two main types. The first one is competitive and the other one will be a non-competitive. So what is the meaning of competitive and non-competitive? This is repetition because already studied in case of antagonist and agonist. Competitive means if someone is fighting or competing for the same binding site. Suppose we have two students and one chair. So these two students are competing with each other to achieve or to get binded or to occupy the same chair. So this is called competition. If there is only one chair, no need to fight with anyone. They will go and simply occupy. But if there are two or more than two, they will fight with each other to occupy this one single chair. That is called competitive inhibitor. But same principle can be applied in the pharmacology also, but there is a requirement for being competitive inhibitor or competitive inhibitor substance. They must be structurally similar with the biological agent with which they are getting fighting. So this is called competitive inhibitor. See, structurally similar to naturally found substrate. These should be structurally similar so that they will compete for the same binding site, and this binding site may be reversible. So this may be reversible. We cannot show sure that may be reversible 100%, but this may be reversible because there is nothing in destruction or there is not destruction of the binding site. So this is chances. There is chances for reversible, but in case of different process like non-competitive inhibitor, there will be different. We will see in upcoming time in this whiteboard section. So if the higher concentration of the substrate will be given, if you want to reversible that process, so if you want to reversible the effect of that process which took place just because of the binding of the substance with the binding site, so you should give the replacer agent with a higher concentration. See, these two are fighting with each other to occupy a single chair, but one is powerful than the other one. So the powerful will replace the non-powerful person and will occupy the seat. But after some time, if more powerful agent, your more powerful person came, then he or she may also replace that same one. So replacement is totally based upon, that means reversible replacement is based upon the concentration of the replacing agent. This is very important. If you increase the concentration, then they may be replaced by another one. This is called competitive inhibitor. But coming to their respective example, these are xanthine oxidase inhibitor. We have studied, or we will study, because we have completed all pharmacology topic in Hindi in our main channel, that is Social Pharmacy. So in this topic we will study about upcoming classes like gout. So example of this competitive inhibitor are xanthine oxidase, which is inhibited by by the allopurinol. This allopurinol is listed under the anti-gout drug, and if you are suffering from gout, there is an accumulation of crystals of uric acid, that is called gout. So it is having so much severe pain, but if you want to get relief from this gout pain, you should use allopurinol. This allopurinol will inhibit the xanthine oxidase and the conversion of uric acid, so that you will get relief from this kind of problem. This is example of non-macrosomal enzyme inhibitor. As in case of disulfiram, this is also affecting the aldehyde dehydrogenase. We will see in the upcoming presentation. So this is called a non-competitive inhibitor. Now second one is this is called non-macrosomal enzyme. Now next one is non-competitive non-macrosomal enzyme inhibitor. So non-competitive, these are not structurally similar with the main drug, natural drug. So they are having chances of non-reversibility because they will destruct the structure of binding site. So how can that will be recovered? To make you better understand this concept, I am going to demonstrate you the few example of our daily life. See, I have a small plastic cavity, or we can say dyes. This is a small structure. We should assume this as a binding site, and this is a drug of main, that's a natural drug. So this natural drug is going to bind on the binding site. So if the drug and binding site, or also called the receptor, if the drug receptor complex is formed, then only we may have biological action. But if there are two drugs I have, so that one drug is main drug, this one is the main drug, and this one is inhibitor, or we can say competitive inhibitor. So if this one, orange one, is having more potency, this one color, this will replace that, and it will took place in the place of the original one. So this is called competitive inhibitor. But in case of non-competitive inhibitor, they will not compete because the drug will destruct. See, this structure is not changing. In case of competitive, just binding of the drug is changing, but the structure of the binding site is not changing. But in case of non-competitive binding, as you have seen in the whiteboard, structure will be damaged by the drug. So now this structure will get damaged, like this one. The structure get damaged. Then how this drug will go to occupy this is not possible, just because of the destruction of the binding site. That is why this is called non-reversible process. So this is a simple expression regarding competitive and non-competitive inhibitor. Now let's move to the another presentation where we will see the basic but most important example under enzyme inhibitor. We will classify the drug according to competitive and non-competitive inhibitor. That will be a very important for your competition exam point of view. So don't miss that presentation. Thank you. Please do watch that video. So here is a table containing example of enzyme inhibitor. Enzyme inhibitor, or we can say enzyme inhibition, can be of two types. The first one will be a competitive inhibitor and the other one is non-competitive inhibitor, as we have discussed in our whiteboard section. So what are the basic example under competitive and respectively in non-competitive inhibitor? So see, first of all we are going to study about the competitive inhibitor. Here two types of table has been included. The first one is for drug example and the second one is for respected enzyme inhibited by this drug. First of all, the first drug is captopril. We will study about this captopril under the antihypertensive drug, because these are the drugs which are used to prevent the hypertension. So this is called antihypertensive drug, and they act by affecting the angiotensin converting enzyme. In short, this is known as a ACE. So captopril is an example of ACE inhibitor. Now next one is allopurinol. Allopurinol is one of the most important drug used under the anti-gout treatment therapy. In this case, allopurinol inhibits the enzyme that's called xanthine oxidase. So this xanthine oxidase is example of non-macrosomal enzyme. So this allopurinol will inhibit xanthine oxidase. Next one is sulfonamide. Sulfonamide is example of antibiotics which give its antibiotic effect by affecting the folic acid synthase. As you can see in this case, synthase at the last it is written as a ASE, and ASE represent for the enzyme. So this sulfonamide affect or inhibit this folic acid synthase, which activity is to synthesize the folic acid. But now just because of sulfonamide, this activity has been reduced. Now next one is meclobamide. This is example of anti-anxiety drug, and they act by affecting the monoamine oxidase, that is called MAO type. This is important. We have studied about this MAO and we will study about this also in the future classes. Next one is neostigmine. Neostigmine is used for the treatment of myasthenia gravis. This will be the next part of your syllabus, and this neostigmine produce their mechanism of action by affecting the acetylcholinesterase. Now what is the acetylcholinesterase? See, this is having two words in this meaningful words, acetylcholine and esterase. So this is enzyme which affect the synthesis or which affect the availability of acetylcholine. So neostigmine affect acetylcholinesterase, whereas same organophosphate is there, and this organophosphate act by affecting this acetylcholinesterase also. So these were the basic enzyme which are included under the competitive inhibitor, though this drug can affect respectively enzyme listed in the table. Now we are talking about the non-competitive inhibitor. Here in this table, as you can see, non-competitive means the competitive and non-competitive can be differentiated on the basis of their structural similarity. Basically, non-competitive are irreversible because this drug can destruct the structure of binding site, so they cannot be reversible again. Example under non-competitive inhibitor are disulfiram. This disulfiram affect the enzyme aldehyde dehydrogenase. We have studied about this aldehyde dehydrogenase. This is example of non-macrosomal enzyme. As you can see, ASE at the last of this name, all are the enzyme on your right side of the table. Next one is isocarboxazide. This affect the monoamine oxidase, as we have studied in the previous one. Next one is statin. This is another important drug used under the category of anti-hyperglycemic agent. This is also known as a HMG coenzyme A reductase because their action is to affect or inhibit this HMG coenzyme reductase. This is an enzyme which is responsible for the reduction of some kind of activity under the hyperglycemic condition. So this statin affect this enzyme and they reduce their mechanism of action by this way. Next and the last one is digoxin, and digoxin produce their mechanism of action, produce their action by affecting sodium potassium ATPase. So these are the basic example of competitive and non-competitive enzyme inhibitors with their respective example and their affected enzyme. So friend, that's all for today. Thank you very much for watching this video. Namaskar. Do take care of yourself.